Imagine you are 67 years old. You are still working. You have health insurance through your employer. And you also have Medicare. You think you are fully covered and fully protected. Then you have a medical procedure and two separate bills arrive, one from Medicare and one from your employer insurance, and suddenly nobody can tell you which one is supposed to pay and which one is secondary. Your doctor is confused. The billing department is confused. And while everyone is pointing fingers at each other, the deadline to pay your bill is getting closer every single day. This situation happens to millions of working seniors every single year. And it happens because nobody ever explained to them a concept called coordination of benefits. In the next 10 minutes I am going to explain exactly how Medicare and employer insurance work together, which one pays first in every situation, and the 3 mistakes that cost working seniors thousands of dollars in unnecessary out-of-pocket bills. Tap the like button right now if you or someone you love is still working and on Medicare at the same time. This video was made specifically for you. Let us start with the foundation. What exactly is coordination of benefits? Coordination of benefits is the system that determines which insurance plan pays first and which one pays second when you have more than one health insurance plan at the same time. The insurance that pays first is called the primary payer. It receives the medical bill first and pays its share according to its own rules. Whatever amount is left over after the primary payer pays, called the remainder, is then sent to the secondary payer. The secondary payer then pays some or all of that remaining amount depending on its own coverage rules. In a perfect situation, having 2 insurance plans means your total out-of-pocket costs drop dramatically. The primary plan pays most of the bill. The secondary plan covers much of what is left. And you end up paying very little or sometimes nothing at all. But this only works correctly when both plans know their role, which one is primary and which one is secondary. When that is unclear or incorrectly set up, both plans can deny the claim and you end up paying everything yourself. Now let us get specific about exactly when your employer insurance pays first and when Medicare pays first. This depends on one key factor, the size of your employer. If you work for a company with 20 or more employees, your employer insurance pays first. Medicare pays second. This is the rule regardless of your age. Even if you are 70 years old and have been on Medicare for 5 years, if your employer has 20 or more employees and you are actively working, your employer plan is primary and Medicare is secondary. In this situation, Medicare acts as a powerful backup. Your employer plan pays its share first. Medicare then steps in and covers much of the remaining cost. For most working seniors in large companies, this combination means very low out-of-pocket expenses for medical care. However, there is an important action you must take to make this work correctly. You need to make sure your doctors and medical providers know that your employer insurance is primary. If they accidentally bill Medicare first, Medicare may pay incorrectly or deny the claim, and untangling that billing mistake can take months of phone calls and paperwork. Now let us talk about when Medicare pays first instead of your employer insurance. This happens in 2 specific situations. The first situation is when you work for a small employer, meaning a company with fewer than 20 employees. In this case, Medicare is primary and your employer plan is secondary. Medicare pays first. Your employer plan picks up some of the remainder. This is critically important for seniors working at small businesses, family-owned companies, or part-time jobs with small organizations. Many of these seniors assume their employer coverage is primary simply because they are still actively working. They are wrong. And when Medicare tries to pay first and the employer plan has been incorrectly set up as primary, claims get denied and bills go unpaid. The second situation is when you are on Medicare due to a disability and your employer has fewer than 100 employees. In this case, Medicare is also primary. The size threshold is different for disability-based Medicare compared to age-based Medicare, and this difference catches many people completely off guard. The simplest way to remember this entire section is one number, 20. If your employer has 20 or more employees, your employer plan pays first. If your employer has fewer than 20 employees, Medicare pays first. Write that number down somewhere, you will remember it. Now let us talk about the 3 mistakes that cost working seniors the most money in this situation. Mistake number 1, not telling your doctors which insurance is primary. Every single time you see a new doctor, visit a new facility, or have any medical procedure, tell the billing department clearly which insurance is primary and which is secondary. Do not assume they know. Do not assume the system figured it out automatically. Tell them directly every single time. Mistake number 2, dropping employer coverage too early when you have Medicare. Some working seniors think, I already have Medicare, so I do not need my employer insurance anymore. They drop their employer coverage to save the monthly premium. This is often a very expensive mistake. When employer coverage is your primary payer and you drop it, Medicare alone may leave you with significant out-of-pocket costs that the employer plan was covering. Always calculate the true cost before dropping any coverage. Mistake number 3, not signing up for Medicare Part B when you should. Some seniors with employer coverage delay signing up for Medicare Part B thinking they do not need it yet. This is only safe if your employer has 20 or more employees and your employer coverage is genuinely comprehensive. If you delay Part B incorrectly, you face the permanent late enrollment penalty we covered in our enrollment periods video, 10% added to your premium for every 12 months you delayed. Here is something most working seniors never find out until they actually need it. When you have both Medicare and employer insurance working together correctly, you can request what is called a Medicare Secondary Payer Questionnaire from Medicare. This is a free document that officially establishes on record which insurance is primary and which is secondary for your specific situation. Having this document on file means that every time a medical claim is submitted, both insurance companies already know their role without any confusion. No denied claims. No billing disputes. No months of phone calls trying to sort out who owes what. Just clean, correct billing every single time. You can request this questionnaire by calling Medicare directly at 1-800-MEDICARE. The call takes about 15 minutes. The protection it gives you is priceless. Let us bring everything together. When you have both Medicare and employer insurance, the system that determines who pays first is called coordination of benefits. If your employer has 20 or more employees, your employer plan pays first and Medicare pays second. If your employer has fewer than 20 employees, Medicare pays first and your employer plan pays second. Always tell your doctors which insurance is primary. Never drop employer coverage without calculating the true cost first. And never delay Medicare Part B enrollment unless you are absolutely certain your employer coverage qualifies. Call 1-800-MEDICARE to request your Medicare Secondary Payer Questionnaire and get everything officially on record. If this video helped you, please give it a thumbs up right now and share it with a family member or friend who is still working and has Medicare at the same time. This information could save them from a billing nightmare that takes months to fix. Subscribe to Medicare Made Simple, because tomorrow we are covering Medicare and Social Security, specifically how your Social Security payment affects your Medicare premium and the one strategy that could lower your Medicare costs significantly. That is a video that could put real money back in your pocket every single month. I will see you in the next one. This video is for informational purposes only. It does not constitute medical, legal, or financial advice. Medicare rules and coordination of benefits rules change annually. Always verify current information at medicare.gov or speak with a licensed Medicare advisor for your personal situation.